Srimanarayana, surgical gastroenterologist and laparoscopic surgeon, Reno Hospital, Sanat Nagar. Coming to the treatment part, the treatment part is based on what we have. Suppose there is a lot of pain, lot of chronic pain is there. First we will try with the pain relief, pain escalating protocol will be there. Suppose basic dolo tablet, basic paracetamol will give. Suppose paracetamol is not working, then we'll go for Ultracet. Ultracet means tramadol and aceclofenac combination. Then next to the any like a morphine drugs, Nucoxia, like that. So step by step we will go, because this type of chronic pain will be everlasting. So we can't give the painkillers at a time. Second thing is based on our structure of pancreas, the treatment will be decided. The more common will be this is the normal pancreatic anatomy. This is okay. I am telling before only, our liver juice will be drained through the pancreas only. Pancreatic duct and the liver drainage will drain into the small part of our stomach, what you call it as the duodenal part. Okay, so this is the normal pancreatic duct, which is joined by the bile duct. Bile duct means liver juicing part, and both are joining together and open into our small part of stomach, that is called it as the duodenal part. In a chronic pancreatitis patients, that straight part of duct becomes like a beaded because of chronic attacks and healing process. This duct will become the straight duct becomes the beaded, which is in that beaded duct will be filled up with the stones. So what is exactly chronic pancreatitis means? The structure damage of pancreatic, we call it as a pancreatitis. So your duct will be damaged, the duct will fill it up with the stones, and these stones will stuck up the pancreatic juicing part. Okay, so whenever patient is eating, the pancreatic juice will be secreted, will enter into the duct. Because of this structural anatomy and the stones are obstructing the duct, there is a more pain. That's why patient will not able to eat. So the basic principle is this type of duct we have to, this is the intermittent obstruction part. So we have to wide drainage and remove the stones. And third one is sometimes this is called it as a parenchyma. Parenchyma means tissue. Sometimes the stones will present in this part also, but we will do only surgery for this drainage tubes, not for this parenchymal stones. Okay, so patient will come with suppose patient will come with a chronic pain, then followed by some diabetes and followed by some steatorrhea. Steatorrhea means loose stools with the greasy stools. We will go for surgery to prevent the further pancreatic damage. Okay, so what are the surgery options? Surgery options will be like just more common is the laparotomy, like a opening of our abdomen, and do our pancreas, the ductal tube we will just cut short and cut it, and we will suture with the small intestine to prevent the pressure on the duct. So the duct will be widely open. There is no pressure on the pancreas to secrete the juices. So as I told, there is any pressure on the pancreatic juice, there is a more pain. I am just relieving the pressure by opening your duct and removing the stones and just wide opening the duct to the small intestine. So there is no pressure and there is no further damage. So obviously whatever the pancreas is remaining, that will be stay together and the pain also will be reduced. So second thing is suppose only small stone is there at this some part of the duct, but the duct is everything is normal. We can do the endoscopic also. That is what we call as the ERCP. Just go for endoscopy and remove the small stone which is less than 5 mm, not more than 5 mm. Less than 5 mm small stones, but in that the duct should be normal, just to remove the pressure on the duct. So second option will be the endoscopic removal with the sphincterotomy. Sphincterotomy means just opening of the door. Okay. And third, suppose patient is pancreas is completely damaged. There is no other pancreas. We have to remove the pancreas, but it's a very rare possibility. remove the pancreas and a pancreatic transplantation, but it's a very rare possibility. So more common treatment options will be the pain relief. If the patient is not able to withstand that pain, also go for the surgery. The most common indication for the pain surgery is the chronic pain, which is the unbearable one. So surgery, so for second option will be the surgery, and third option will be the small endoscopic procedure like a ERCP. Just go endoscopy, remove the stones, but in that the ductal anatomy, ductal structure should be the normal. This, and third and last option will be the pancreatic. Suppose complete pancreas is removed, damaged, we have to remove the pancreas. Very rare possibility, almost like a 10 in almost like a 1 lakh people, 1 or 2 cases will go like that. This is the problem. And suppose what I am told is, suppose during this pancreatic attack, our bile duct, suppose our liver juice pipe also got injured, we have to do one more procedure, that is called as the drainage of this tube also. Okay, suppose at the same time our duodenum part means small part is also got damaged, we have to bypass this one also. So that's why all investigations needed to know the proper structure of everything. Okay, sometimes only drainage this one, sometimes add 1 and 2 also, sometimes drainage of our pancreas, drainage of our bile duct, drainage of the duodenum, all this process what you call as a triple bypass based on the structure. And the problem is, some patients in a chronic pancreatitis sometimes may present with the cancer also, but we can't identify the preoperative. Only during the surgery only we noticed some hard lump is there, which is encasing. Encase means structure is involved, that is the malignancy. But in chronic pancreatitis, suppose if you got the cancer, it's very difficult to do the surgery because already full structures are involved. So we have to remove everything. That is called as the Whipple's procedure. So we will remove the half of the pancreas, bile duct half of the part, and small part, everything all involved. That is the big surgery, almost like a 6 to 8 hours. Sometimes we may not proceed also because our liver drainage pipes, blood circulation, so everything is got stuck up. So that is the just to do the bypass, because we can't do big like a vessel surgery, we can't, that time we know unable to do also. Okay, but 50 to 70% patients we can remove it. So this is the treatment options for the chronic pancreatitis. Thank you.